The patient was awarded $70.8 million in damages, but due to a Medicaid law, the patient may not be able to see all that money with a cap of about $300,000, which is a significant difference. The hospital is also actively seeking to reduce the $70.8 million negligence award to about $20 million. Wow. Wow. Whew. So y'all, this is a lot to unpack, okay? This is a lot going on in this case, and we're gonna get into it. All right, y'all, so let's get into the commentary, and this is just my unbiased opinion. I'm just looking at the case. I can't look at the actual chart or what the nurse practitioner actually did. I'm just reading the article and I'm giving my opinion just based on that. So in medicine, I don't think the intent is ever to hurt the patient. I think this is like the worst case scenario of what you just don't want to happen in medicine. But unfortunately, in this situation, a patient did get hurt and she has lifetime deficits as proof that she did not receive the care that she should have received. So negligence really is you having the right to act to a certain standard as a healthcare professional. Everybody is supposed to give the patient the same standard of care. So there was a breach of the right to act on the nurse practitioner's part. She was supposed to order a CT scan in this situation, or at least refer the patient to neuro, but none of that occurred. As a result, the patient was injured because had they done the CT scan, they would have found clots and took the right precautions and the right measurements in this situation. And this would have prevented any further injury. So guys, I really feel bad that the patient was injured, and we're not going to try and sit here and refute the fact that the patient should be awarded some kind of money to be able to take care of herself for the rest of her life, okay? And I don't agree with $200,000 or $300,000 max with Medicaid because this patient was left blind, okay? She has so many deficits and she's not able to work as a result. So I don't agree with that, but the patient should absolutely receive a good amount of money in this situation. All right guys, so these were some of the things I noticed in this situation. So the patient came in with the worst headache of her life. I'm not sure if she phrased it that way, but obviously for her to come through EMS, that means that her headache had to be really, really bad. And given the fact that she has diabetes, which increases your risk for basically everything, and she also was on recent birth control, that should have been an indication that maybe this could be something sinister. So it appears that the patient is Black. I'm just saying that based on her name, which we're not going to say because I don't want to put the patient's information out there like that, but it appears she's Black. Most likely her blood pressure was really high. She has diabetes and she was on recent birth controls. Those are already some red flags for me, which indicates to me that the nurse practitioner should have definitely ordered that CT scan just to be sure that this patient is not having a stroke. So in this situation, doing an extra test would not have harmed the patient, but not doing one did. And secondly, I'm not sure if the patient has a history of migraines, but it appears that the nurse practitioner thought that maybe the patient had a migraine, so she gave the patient that migraine cocktail that we discussed earlier. And this is definitely not something you want to give to a patient that's having a stroke, because if NSAIDs were included in that migraine cocktail, that could cause further bleeding if the patient's having a hemorrhagic stroke, which is a stroke that causes bleeding to occur on the brain. And another thing that is concerning is that, after this migraine cocktail, was the patient feeling better where she was comfortable just sending the patient home, or was the patient still in pain? And it's one of those things where it's like, okay, you'll get better later. Just go take some Tylenol or go take an Aleve or something. So I'm not really sure what was discussed with this patient or if there was any instructions for following up. When a patient comes to the ER for a headache, it could be so many different things, but a sudden headache that is a thunderclap headache, which is a really bad headache, that is cause for alarm. So I'm not sure if she took the time to come up with a differential and rule out the worst case scenario, and then found that, okay, this patient is not at risk for these other things, these other bad things that could be the cause, and maybe it's just a migraine. I'm not sure if that's what happened, but that is the standard of care. You always, always, always have to rule out the worst case scenario. So this commentary is not to tear down anybody. This is not to judge anyone because I wasn't there. I'm not sure what happened, but it was obvious that the standard of care was not provided to this patient and it caused damages. But these are some of the things that I learned from this situation. So first thing is do the extra tests. I think that doing an extra test can always help you, but not doing one can certainly hurt you. And you also have to make sure you take time, even though the ER is busy. And I know that the ER is very stressful for providers, and most people are trying their best to provide the best care to their patients. Sometimes you just have to really just slow down and review the patient's chart, get a really, really good history, because the history tells you basically what you need to know about what's going on in the situation. So you have to take time to do your assessments, get a really good history, and really talk to your patient to figure out what's going on and really find out what the risk factors are and tailor your care accordingly. Also, as a nurse practitioner and a PA, we just have to learn to ask for help when we need it, because at the end of the day, this is a team effort, okay? It's not, let me just take care of this patient on my own to prove that I know what I'm doing. You always have to just make sure you're collaborating. If you're not sure about something, especially when it comes to strokes, heart attacks, and things that are true emergencies, you really just have to consult with the team to figure out what's going on with this patient. You also have to protect yourself and protect your license. So no matter how busy it is in the ER, you always have to just slow down and deal with one patient at a time. Of course, we know you have to multitask, but when you are rushing too much, you can just make so many mistakes and it could cost people their lives. All right, guys, so I'm not sure what happened to the sound at the end of this video, but I want to thank you guys so much for watching this episode of Munchin Medicine. I do want to hear what you guys think in the comments. Do you think this was a fair judgment for the patient? Do you think that she should be capped at $300,000? If not, how much do you think she should actually receive? Something that I was also wondering is what happens to the rest of the money if the patient is capped at $300,000? I had so much fun debunking this news story and munching and talking about medicine with you guys. I hope to see you guys on the next one. Bye.